2009 that 10% of sexually active females have chlamydia. So if you have an orange sticker, could you please stand up, male or female? So this is the statistic of males and females, that 10% that have chlamydia.
And the last sticky is the green sticky. So if you have a green sticky, please stand up. 16.2% of Americans between the ages 14 and 49 had herpes in 2009. You are part of this statistic. Please sit down. Sorry.
Alright, chlamydia, if you didn't know, is like the most common STD in the US, and there's over 4 million cases every year. And some of the symptoms will be soreness in the genital area and itching in that area as well. And you'll notice for men and women, some of the symptoms are the same, but for women, it's painful when they use the restroom and urinate, and the urine will be cloudy, and in that area, like I said, will be itchy, and the glands in the vagina will be swollen, and they will have fever and general tiredness as a symptom as well. And for men, just like women, they have painful urine, and it's cloudy, but there will be watery, slimy discharge coming from your penis, and it'll be crusty around the tip, and your anus will be tender. So those are the symptoms for men. And there are treatments for chlamydia. It is curable, but if it's left untreated, it's going to be an abscess to the form, which is like a big boil or a pimple, and it has to be drained either medically or professionally. And these are some of the antibiotics that will treat it, but the antibiotics have to be used consistently and quickly to treat the abscess, or it will continue to spread. And the women, if you go untreated, you risk getting PID, which is pelvic inflammatory disease, and you will experience infertility, which is you won't be able to have babies, and you risk fatal ectopic pregnancy, which is pregnancy outside the uterus, which is very bad for you women. And the men, you risk sterility, which is kind of the same as infertility. It's just you won't be able to produce sperm, so you won't be able to have babies. And the tube that carries your sperm in your urine, it will get infected and could possibly burst. So that's what happens if you go untreated.
Syphilis is a common infection. Up to 50,000 people can get it each year in the U.S. It consists of 3 stages: primary, secondary, and last. It is caused by the bacterium Trinophium pendilium, which can be transmitted through sexual intercourse or from a mother to the child during pregnancy, which is called congenital syphilis. The symptoms for syphilis are split up between these different stages of it. The primary stage, you can have a painless ulcer or fever or headaches constantly. For secondary stage, a person can get a non-itching rash, wart-like lesions in the genital area, or swelling of lymph nodes. And for the third stage, a person can experience heart problems. For the treatment of syphilis, in the first stage, which is less than a year, you only need 1 injection of penicillin. During the secondary stage, which will be longer than a year, you need to receive additional doses of penicillin. And if you're in the last stage, treatment will be given that can kill the bacteria and prevent further damage, but it cannot help the damage that has already been done.
Okay. Gonorrhea is a sexually transmitted infection caused by the bacterium Nyasia gonorrhea. This bacterium can also cause urethritis, cervicitis, prostatitis in men, and pelvic inflammatory disease in women. Recently, it has been found that people who become infected with gonorrhea may also be at risk for other STDs, including HIV. A million people are affected each year, and the common people usually get it have multiple sex partners. and the number of infected young people is increasing each year. Symptoms for women would be a yellowish discharge from the vagina and spot in between periods or after sexual intercourse. 10 to 20% of women who are infected with gonorrhea develop PID, which is pelvic inflammatory disease. Then the infection, if you get PID, the infection then moves from the cervix to the uterus, to the fallopian tube, and the ovaries. You can also have pain in your pelvis, pain with intercourse, and fever. If you get PID from the infection, PID can cause scarring, and scarring from the infection can increase the risk of infertility and ectopic pregnancy. And if the infection gets to your cervix, you can also get it in the rectum area, even if you don't have anal sex. Symptoms for men would be a yellowish discharge from the penis, which is accompanied by a burning sensation while urinating, and just an overall irritated feeling in the penis. Sometimes the penis may become swollen, and the urethral opening can become inflamed. If the gonorrhea causes prostate infection, then there could be a pain between the testicles and anal area, difficulty when urinating, and you may need to urinate more frequently than regular. Okay, the treatment for gonorrhea can be cured, and if you are diagnosed with the disease, you can receive a shot of ceftriaxone, or you can also get a single dose of an oral medication such as ciprofloxacin. If the infection is really intense, then a longer course of antibiotics is needed.
HIV and AIDS. HIV is human immunodeficiency virus. It can lead to AIDS if the body is not treated right. The AIDS take over the body. African Americans and Hispanics are at the highest risk of getting HIV. It can be contracted in 3 ways. A child can get it from their mother, also through sexual intercourse, oral, vaginal, or anal, and exchange of body fluids. If people use other people's needles, you get it that way. These are the symptoms: flu-like symptoms, night sweats, viral infection, weight loss, fever, lymph node swelling, and recurrent infections. Unfortunately, there is no cure, but there are treatments that can decrease these symptoms, and this is antiretroviral therapy. This consists of 3 or more anti-HIV medications daily. It keeps the CD4 count up. The CD4 are cells that help your body fight infection and keep you healthy. If it goes untreated, it becomes AIDS. Like I said before, AIDS is when the disease takes over your CD4 cells, and it's acquired immune deficiency syndrome. AIDS is when your CD4 count is less than 200 cells. Whites, African Americans, and Hispanics who have who have HIV are at high risk of getting AIDS. Herpes, there are 2 types of herpes, type 1 and type 2. Type 1 is more severe and the symptoms are more severe than type 2. 16.2% of Americans are infected between ages 14 and 49, as I stated earlier.
The symptoms for herpes, there are not many of them, but you get an outbreak of blisters, and the outbreaks are usually mistaken for acne, but it's not. The blisters are painful and they leave sores. They'll last about 2 to 4 weeks, and the outbreak will repeat and you'll have flu-like symptoms.
There is no cure for herpes, but there are treatments, antiviral medications which prevent or shorten the outbreaks, and daily suppressive therapy, which is taking medications daily to decrease the chances of infecting others.
The way you get herpes, get the infection is having sex. That includes anal, oral, or vaginal. You can also get it from sores, so if somebody else has a sore and you touch it, you can get it, you know, like if they have it around their mouth and you touch their mouth and touch your mouth, you can get it. A lot of people who don't have symptoms will have normal looking skin, but if they, you know, if they still have it, you can still get it even if their skin look normal. And just from touching sores, touching each other's sores or whatever.
You're gonna play a game called Name That Disease. We have pictures, so like if you have a weak stomach, just don't look. We're gonna have prizes if you get like it right. So raise your hand if you think you know what this disease is. Does anybody know? And this is like somebody's back and somebody's throat.
Is it syphilis?
Anybody else?
Anybody else wanna guess? It's actually HIV. This is somebody's eye, penis, and a vagina. Does anybody want to guess what the disease is? Anybody?
Is it herpes?
Let's see. Any guess?
Okay, this is the back of someone's throat and someone's penis. Does anybody know what this is?
Right. Good job. Does anybody know what this one is? Somebody's now.
These are blisters around your lips.
And you can see it looks like acne.
Herpes.
This one has sores on the hand, the back, and the little baby. Anybody know what this is?
Syphilis.
Okay, what has been done already on campus would be Project Safe. And Project Safe is an organization that helps prevent STDs on campus. They're available during 1040 break on selected days, and they focus on HIV. Also, it's free condoms. Do anybody know what a health building is? Anybody know what a health building is?
Across from the C-store?
Yeah, okay. In the health building, you can get free condoms. And also in your dorms, if you go to the lobby, they also have free condoms sitting out on the desk. Also, there's informational sessions, which is held by Project Safe from time to time. One that just passed will be the condemnation tour, which is on the 18th of September, and they're doing free testing in the union.
One that's coming up is World AIDS Day, and that's November 13th. In the School of Education, most of the organizations on campus will be having presentations about AIDS and HIV, and it's going to be from 6 to 9 p.m. We came up with a solution, free testing. There should be free testing in public schools and colleges. Most of the people who have STDs are between the ages 18 and 24, which is the age range of most college students. I'm going to have a little informational video.
Hi, I'm your best friend.
why we're excited. Does anybody have any questions for us?
I have a couple.
Okay.
Go ahead.
What, like with the syphilis, you said the cure for that is penicillin. Is there any other cure besides penicillin for people who are allergic to?
I didn't understand the question.
She
I didn't
asked.
even hear the question.
Penicillin is the cure for syphilis. She asked if there was anything else because some people, like myself, are allergic to penicillin. So, like, if there's no other cure for it other than penicillin. So it's either live with it or like die from trying to get cured from penicillin. So either way, it's like live with it.
And before you ask your question, Ms. Williams, quick fact for chlamydia. Chlamydia is the only STD that's not cured by penicillin. So you can't just think you had gonorrhea, you got it cured by penicillin, or you had syphilis, you get it cured by penicillin. It won't work for chlamydia. So that's just a quick fact. So you can ask your question.
Okay. The first question I have is, during my generation, if you got syphilis or gonorrhea or whatever, you could take a shot in the behind and be cured. However, your generation is suffering with something that can't be cured. How does that affect your generation as far as being sexually active or being able to talk to your partner or ask them questions about this?
Most people like don't feel comfortable asking. So I mean, it's increasing the spread of STDs. Is that answer to your question?
Anybody want to help out?
I would say in some situations it increases like the rate of you talking about it because some people feel more comfortable about talking about STDs more than others. Like there are some males and females that will actually confront their partner and ask them if they have it rather than some people who just feel like they're so in love with that person that they just take that risk and not ask them at all. And you said it's just curable, like taking a shot in behind. But since it's not like that no more, people should be more cautious. And there are some people that are cautious and take precautions, like going to get checked and making sure their partner is checked. But that's just a personal thing for that person.
Anybody else? Second question. This generation, again, the HIV and AIDS epidemic is affecting you more adversely than it's affecting any other demographic group. Has your awareness about sexually transmitted diseases, and if it has heightened your awareness, what are you doing as your generation to prevent yourselves from getting HIV and AIDS?
Some people get tested. I know most females are not supposed to have pap smears until 21, but some do. You can actually get go to your doctor and get just a STD check without the pap smear. That's what I do yearly, and my parents do yearly. We get checked.
But then a lot of people only get checked yearly, you know what I'm saying? And you won't get an infection just when around the time that you're going to get checked. So like if you just got checked one day and then you had sex with whoever 2 months later, you won't get checked until the next year come around, so you'll have that infection for almost a year. So it'll be hard to get rid of.
Protecting yourself.
Yeah, condoms.
Condom, and a lot of people that I know personally, they think that birth control helps
Oh no.
against, STDs when it don't. You still, even if you're on birth control, you still have to use a condom, and you still have to be protected, get tested, and things like that.
And television also heightens the awareness because you see it almost every day in commercials by HIV and other STDs. So that kind of heightens the awareness that you should go check.
Okay, third and last question. African American women are the largest growing group of individuals that are infected with HIV and AIDS. The African American women in here, how do you feel about that? Yes, ma'am.
It's a scary thing. Once again, you gotta protect yourself.
I think African American women can be stubborn at times, and a lot of us be like, oh, well, I love them so much, and won't think to get tested, ask that person, or even use condoms because we want to trust them so much. But, I feel like since we know that the number is rising, that should make us be more aware. Being that the number is rising, we should want to get tested more, want to use condoms constantly, whether you think you love that person or not. Even if you can be married, you can still get an STD. So, I mean, you should get tested, use condoms, and maybe then the number will go down.
Any other comments? Questions? Thank you.